Okay, this presentation will clearly identify and discuss the disease and the pathophysiology, how the disease presents in clinical manifestations, duration, progression, course of disease, outcomes and expectations, including patient-centered education. It classifies and discusses all treatments, one primary nursing diagnosis with 3 interventions, and an advanced rationale for each. In a normal human body, there are 23 pairs of chromosomes in each nucleus. A cell is then made that obtains a chromosome copy from an egg and a sperm. After the cell splits and reproduces, it creates an embryo, which is eventually a fetus. Every individual cell is then comprised of equal genetic makeup, DNA, and genes as the original 48 chromosomes. Down syndrome occurs when there is an irregular division of the cell involving chromosome 21, which in turn creates an extra copy. Alternatively, there are 46 chromosomes with an addition of 1 pair of sex chromosomes, making it so there is 47 instead of 48 chromosomes. With the creating of this extra genetic material, it becomes responsible for the development problems associated with Down syndrome. There are 3 genetic differences that cause Down syndrome: trisomy 21, mosaic, and translocation. Trisomy 21 occurs when there is an abnormal division in the cell during the development of the sperm and egg cell, resulting in 3 copies of chromosome 21. In normal cell development, there are 2 copies in the embryo. Trisomy 21 occurs in approximately 95% of all cases in Down syndrome. Mosaic Down syndrome results rarely in approximately 1% of all cases of Down syndrome. It is diagnosed when there is a combination of cells with the original 46 chromosomes, and some are encompassed with 47. The cells that contain 47 chromosomes have an extra chromosome 21. Some research states that those with mosaic Down syndrome can have less cognitive abnormalities than other types of Down syndrome. Translocation results in about 4% of all cases of Down syndrome. With this type, it encompasses the normal 46 chromosomes. Nevertheless, a portion of chromosome 21 attaches to another chromosome, in most cases being chromosome 14. The occurrence of this additional complete or incomplete chromosome 21 causes the features of Down syndrome. This picture shows some of the manifestations of Down syndrome. The presentation of Down syndrome. The cause of the extra chromosome 21 is still unknown. There is no conclusive scientific research that shows that environmental factors or the parents' habits or activities cause Down syndrome before or throughout the pregnancy. I did find this on What is Down syndrome. Maternal age is the only factor that has been linked to an increased chance of having a baby with Down syndrome resulting from non-disjunction of mosaicism. However, due to the higher birth rates in younger women, 80% of children with Down syndrome are born to women under 35 years of age. These are some of the clinical manifestations of Down syndrome. With the central nervous system, mild to moderate intellectual disability and hypotonia at birth. Head is flattened, occipital, depressed nasal bride, mongoloid slant of eyes, epicanthal folds, white specking of the iris, protrusion of the tongue, high arched palate, and low set ears. With the hands, you'll see broad, short fingers, abnormalities of the finger and foot, dermal ridge patterns, transverse palmar crease. Some of the other ones you'll see with Down syndrome are congenital heart disease in approximately 30 to 40%, usually correctable by surgery. This slide is just showing some of the symptoms of Down syndrome. This slide is duration, progression, course of disease, outcomes, and expectations. Individuals with Down syndrome possess varying degrees of cognitive delays from very mild to severe. Most people with Down syndrome have cognitive delays that are mild to moderate. Due to the advances in medical technology, individuals with Down syndrome are living longer than ever. In 1910, children with Down syndrome were expected to survive to age 9. With the discovery of antibiotics, the average survival age increased to 19 to 20. And now, with recent advancements in clinical treatment, most particularly corrective heart surgeries, as many as 80% of adults with Down syndrome reach age 60, and many live even longer. Increasingly, Americans are interacting with individuals with Down syndrome, increasing the need for widespread public education and acceptance. The treatment for Down syndrome is regular screening, early intervention, and active management of identified problems are essential because there's no cure for the disorders caused by the syndrome. Surgery to correct cardiac abnormalities, gastrointestinal malformations, and craniofacial deviations have been used to prolong life, alleviate discomfort, and decrease the likelihood of further medical complications. Neck radiography should be performed before the child participates in any sports because of the risk for children with Down syndrome to have atlantoaxial instability. We need to advise parents on community and educational services available to them so they can better care for the special needs of their children. Facilitation of appropriate playtime. We also need to educate parents to explore options for fluid and calorie intake, as well as inform parents that breastfeeding may not be possible if the child's muscle tone or sucking reflex is immature. We need to provide resources for behavioral training to encourage intake of new foods or the acquisition of new skills. Educate parents that children with Down syndrome benefit from regular schedules because changes in the child's routine can cause frustration and decrease coping abilities. As the child grows, advise parents to encourage participation in recreational activities that child can manage. The primary nursing diagnosis I would choose would be self-care deficit, bathing, dressing, feeding, toileting related to perceptual or cognitive impairment. These are some interventions. One of them could be nurse will avoid upsetting factors associated with bathing. Instead of using the terms bath, shower, or wash, use comforting words such as warm, relaxing, or massage. Start at the client's feet and bathe upward. Bathe the face last after washing hands and using a clean cloth. Use a beautician or barber to wash hair at another time to avoid water dripping in the face. The rationale for this is some words are associated with unpleasant bathing experiences, whereas other convey a pleasant bathing experience. Starting with the face or hair is distressing because water drips on the face and the head becomes cold or wet. Second intervention could be nurse will have the family install a toilet seat of a contrasting color because visualization of the toilet is aided by installing a toilet seat of a contrasting color. Third intervention, recognize that dressing is a private task. Encourage patients to participate as much as possible regardless of length of time needed because patients may be embarrassed when needing assistance to dress, so discreet help should be provided with those with Down syndrome. And these are my references. Thank you for watching.